Eloctate, anti-hemophilic factor recombinant Fc fusion protein, presents A Walk in the City. Meet Guy. He's just like me and maybe some of you. He was diagnosed with severe hemophilia A at birth, but that doesn't stop him from exploring the city and trying new things. Guy, have you thought about your dosing schedule? Why not check out more options? There may be something that's right for you, like Eloctate, where the suggested starting dose is every 4 days at 50 IU per kg. Eloctate is a great fit for me, but everyone is different. Depending on your own situation, your doctor can make adjustments to your dosing regimen to every 3, 4, or 5 days. With doses in the range of 25 IU per kg to 65 IU per kg. And as you know, children younger than 6 may require more frequent or higher doses, up to 80 IU per kg. Eloctate is the first and only factor with a prolonged half-life, and the longer a factor's half-life, the longer it stays active in your system. In the clinical study, people who treated on demand with Eloctate had about 33.6 bleeds per year. The study also looked at people on Eloctate prophy treatment every 3, 4, or 5 days. They had a median rate of 1.6 bleeds per year, with 0 joint bleeds and 0 spontaneous bleeds experienced that year.
During the study, people on either prophy or on-demand treatment experienced 757 bleeds.
87% of those bleeds were controlled with only 1 infusion of Eloctate. Common adverse reactions in the Phase 3 clinical study were joint pain and general discomfort. Each occurred in 1.2% or 2 people. So think about the options you have in front of you and talk to your friends, your hemophilia community, family members, and healthcare provider about their experience with Eloctate. Make sure to ask your healthcare provider what infusion schedule could be right for you. Ask about potential benefits and risks and other questions. There's even a doctor discussion guide you can download at eloctate.com.
Indications: Eloctate, anti-hemophilic factor recombinant Fc fusion protein, is a recombinant DNA-derived anti-hemophilic factor indicated in adults and children with hemophilia A, congenital factor VIII deficiency for control and prevention of bleeding episodes, perioperative management, surgical prophylaxis, and routine prophylaxis to prevent or reduce the frequency of bleeding episodes. Eloctate is not indicated for the treatment of von Willebrand disease. Important safety information. Do not use Eloctate if you have had an allergic reaction to it in the past. Tell your healthcare provider if you have or have had any medical problems. Take any medicines, including prescription and non-prescription medicines, supplements, or herbal medicines, have any allergies, are breastfeeding, are pregnant or planning to become pregnant, or have been told you have inhibitors, antibodies, to factor VIII. Allergic reactions may occur with Eloctate. Call your healthcare provider or get emergency treatment right away if you have any of the following symptoms: difficulty breathing, chest tightness, swelling of the face, rash, or hives. Your body can also make antibodies called inhibitors against Eloctate, which may stop Eloctate from working properly. Common side effects of Eloctate are joint pain and general discomfort. These are not all the possible side effects of Eloctate. Talk to your healthcare provider right away about any side effect that bothers you or that does not go away, and if bleeding is not controlled after using Eloctate. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information.